Welcome back. We're checking our D.C. Pulse for you, getting a look at the top stories our D.C. Bureau is working on for you today. Federal health officials are encouraging the use of telehealth services instead of visiting the doctor in person. But those without broadband internet service don't have that option. Many of them living in rural America, some of those right here in East Tennessee. Washington correspondent Jesse Tenur now hears from lawmakers trying to level the playing field and save lives.
We can make certain everyone during these times of a pandemic have access to care.
Telemedicine is now the first line of defense against the spread of the coronavirus pandemic. Congress recently brought in telehealth services to allow more patients to see a doctor on their phone or computer without risking further infection to themselves or others. But Tennessee Senator Marsha Blackburn argues many are still left out.
You cannot have access to 21st century health care or emergency response without access to high-speed internet.
Blackburn wants her Senate colleagues to include rural broadband expansion in their next coronavirus relief package.
The care you're able to receive does not depend on the zip code where you live.
Senator John Kennedy also sees the effects of a digital divide in his home state.
We've learned in Louisiana a lot of our rural areas don't have internet. Forget about 5G. Or 4G, they don't have any G.
Kennedy has introduced legislation that would give states billions of dollars for rural broadband infrastructure. But the fiscal conservative says coronavirus has put it on the back burner.
I mean, we don't have time to pass it now.
But the appetite in Congress for expanding broadband remains, with some of Kennedy and Blackburn's colleagues supporting expansion not just for telehealth, but also for the kids and parents now learning and working from home. In Washington, I'm Jesse Tenor.